Part 2 of my videos on the day hospital market in Australia. And what we know is we're continuing to see day hospitals grow in the Australian marketplace. So now it represents about 54% of the private healthcare market in Australia, which lends us to think about what are the key headwinds and tailwinds that we're seeing in this space, particularly given recent times of COVID and in particular more recent times of government regulations. So let's look first at the headwinds, and I'm just going to touch on 3. And the first one is the funding models not evolving, and those models not being fit for purpose to enable alternative models of care that we're evolving into, such as day hospitals. And that links in with the second component, which is also the regulations not evolving and the regulatory environment also not moving outside of that traditional bricks and mortar of hospital environments for alternative models of care. And the third headwind to touch on is the economic conditions. And the economic conditions continuing to be tough, that it's not the right environment to support the sort of scope and scale of investment that is required in the day hospital market. So then if we flip the coin and we look on the other side of the tailwinds in the market, and some of them do kind of double up in my opinion. So the first one to touch on is the societal shift from the patient. And, this really sees the patient driving this choice model. They want these forms of care available to them. The second one that we're going to see is that continued drive we hear a lot about is medical advancement in AI, and I think undoubtedly in my mind we're going to see this continue to drive efficiency and optimization in the healthcare environment, but also improved clinical outcomes. So I think that's a key tailwind. Then we link into some of the ones that kind of have a foot in both camp, which in my opinion is the economic conditions. And I think continued tough economic conditions where we've got an ageing population, ageing sort of chronic diseases and complications in the health system, that really has a cost model that's not sustainable. And so what we're going to continue to see is people like private health insurers particularly be really interested in lower costs and improved outcome models such as the day hospital market. And what we're also seeing there is this shift and focus of patient-centred care and high-value care, and I think that is just growing increased momentum in the healthcare ecosystem, and I think that will continue to do so. And finally, again, it's from an economic perspective. In my opinion, we've seen healthcare be quite an attractive industry for investors, private equity firms, etc. in recent years, particularly post-COVID. And I think that can bring new players for investment into models like the day hospital market. So a few thoughts from me on heads and tailwinds in day hospital market.